So Claudia, I saw you trying to come up, so go ahead and turn your camera on. President at Porterville College, Claudia Habib.
Good afternoon, everybody. Thank you, Dr. Christian. It is a pleasure to be here this afternoon with Donna Hefner, President and CEO of Sierra View Medical Center. Donna, thank you so much for being part of the KCCD Chancellor Seminar Series. My first question will help the audience understand the scope of the work of Sierra View Medical Center. So if you can share with us, what is Sierra View's service area and how has your role has been affected during the pandemic?
Thank you, and it's an honor to be with you today and to talk about the services we're providing here in response to the pandemic. It has been a very challenging time. We are a 167-bed community hospital that serves over 110,000 lives in the southeast portion of Tulare County. And we have been here since 1958. These have been some of the most challenging times for us. I've been with the hospital for now 31 years. And I have this time through this pandemic has been the most challenging. Although we started and identified the first case of COVID in Tulare County back on March 11th of last year, we prepared and put our systems in place to be able to keep people safe. And we weathered that initial impact, but it came in the winter months, November, December, and January and February, where we were actually seeing some of the highest and sickest individuals related to COVID. Most recently, we have seen another impact related to the COVID cases. In July, it's actually identified 10 patients with Delta variant in July of this year, and we started seeing our first hospitalizations around August 5th.
Wow. Well, we hear a lot of positive news about California's positivity rate. But as you mentioned, it's been different in these counties. What factors explain the rise of COVID cases in Tulare County in particular compared to California's decreasing numbers?
Yes, I appreciate that question. And what we are seeing on the hospital side is we see a mixture of patients with COVID-like symptoms, but we also see patients that are very, very sick due to their medical conditions. So we have had I would say maybe a slower adoption acceptance rate to the vaccine. But as a result of the last couple weeks, we have been seeing an uptick in people visiting our vaccine clinic here locally. And that also is helping, I believe, with the impact of reducing COVID and the severity of patients with COVID like symptoms. So the Delta variant is 1,000 times more variant than our initial COVID and so we are actually responding to that.
Have you seen any cases of the new variant?
We have not. All of the patients, the variant is actually determined by the county. So the epidemiologist with the county actually makes that determination and does that testing. So we do the collection of the specimen and send that off to the county for that testing. So I have not heard that we've identified, unlike Los Angeles, I understand there has been identification of the new variant, but I have not heard that we've identified that yet.
Okay. And Donna, how do you see this surge being different than a year ago? What do you think is the challenge this time around?
It is definitely a staffing crisis. We had actually recognizing in the winter months, we do have to put our ask into the the agency staffing organizations to put our request in. we had put in 22 requests for registered nurses, and we were not seeing very many coming through as far as September. And it was actually, we had 9 registered nurses as agency staff. And then it was today that we've actually onboarded 20 registered nurses. That will 9 registered nurses for the ICU, 8 registered nurses for the med-surg COVID unit and telemetry unit. And we have 5 emergency department registered nurses that will be working nights and days shifts. So this pandemic, this wave since August has been around. We have over 100 employees out on a leave of absence, so they're unable to be able to provide the staffing. We also have staff taking care of their children who have become sick with this variant. And also we have those that are actually on intermittent leaves as well. So it's been very, very challenging to staff the beds that we have available. And we pulled registered nurses in other roles in our organization back to the bedside to be able to care for the sick patients.
Wow, very difficult time. How are the hospital nurses and the doctors holding up through all these crises?
I can tell you the last 5 weeks we are tired, and it's been really, really challenging. I spend time rounding. We have self-care carts that we take around to our floors to try to give people a little snack. Some have told me over the weekend that that was their lunch, and so we've been ordering in pizza. We've had a couple taco days where we were able just to get food to the staff. And but yes, they are tired, and they are still very compassionate with the families and the patients. But I have to share with you that I had one of the most heartwarming calls that came in last Tuesday from a patient that was in upstairs, and she just wanted us to know, or specifically to me, that she couldn't have gotten through this without the wonderful staff that have helped her through her most darkest times, and felt very lonely. And so she was just very complimentary to the staff, and those kind of stories really help pick up the staff's, and they really appreciate that very much, those personal stories.
Wow, well, thank you for sharing that. Donna, we have had a partnership for a long time. I appreciate so much the way we communicate, the way we have supported each other. But is there anything that we at Porterville College can do? What role can we play to assist during this pandemic?
Well, the nice part about this time since last year, when we had the initial impact, is we've been able to keep the student rotations coming through our organization. And that has also played a very beneficial role for us, because patients are able to connect with the nursing students and the psych tech students. And so we appreciate your support in regards to keeping the students engaged in the health careers, because they are very much needed, and I'm very appreciative of that. So, obviously this time these students' acceptance of vaccine and keeping themselves safe has been also very beneficial. One thing that we're experiencing is that some individuals cannot get the vaccine based on 2 exemptions, medical or religious. And so there is some ongoing testing requirements that are upon us on a weekly basis for those individuals. But really, where the college has been very supportive, we also appreciated the day when you came to visit us, and all of your faculty adopted us for the day and brought us all those wonderful treats. So we appreciate the ongoing conversations and support, and just your passion with developing the health career pathways. So thank you very much.
Thank you, Donna. This is a great partnership. So to end our conversation, Donna, what is the most pressing message that you would like to communicate to our community about the COVID-19 virus?
The most impactful message is we have to practice the basics. We have to be good hand hygiene. We have to do our social distancing. Just work those basic principles really help prevent the spread. We ask that you as individuals, if you are questioning your decision about getting the vaccine, we ask that you speak to your provider, your physician that knows your medical history the best. And we ask that you do that, very meaningful and come back with a decision that is helpful. If you do choose to get the vaccine, there's various clinics in Porterville and Tulare County that are open to you, and we support that as well. We have a vaccine clinic Thursday, Friday, Saturday, Sunday that is a partnership with Imperial Ambulance, and we've had some great support in that regard. So thank you for your time.
Thank you. Thank you, Donna Hefner, CEO of Sierra View. Thank you for speaking with us. And now the audience will have a chance to hear from Michael from Cerro Coso. Thank you.